going to be starting shortly. I want to acknowledge some special guests with us today. We have our chair, Angelo Gavrielatis, the president of the New South Wales Teachers Federation, and he'll be speaking in a moment. We also have APHEDA board members, Michael Wright from the ETU, Andrew Detmar from the AMWU. And it's also great to see senior officials from around the country, senior union officials, including Judith Kedger from the New South Wales Nurses. We also have joining us today, Helen McHugh, the co-founder of APHEDA back in 1983 and 84, and the first executive officer as well. We have Jenny Leong, who is a member of the New South Wales Parliament, the member for Newtown, and it's also wonderful to have Claire Moore, the former International Development Minister for the Australian Government, joining us. We also have many friends from the Trade Union Solidarity Network around the world, including our friends from FNV Mondiale in the Netherlands. And of course, we have many APHEDA activists and friends online with us today. I just want to remind you that this webinar is being recorded. I encourage you to interact in the chat box and also to ask your questions in the Q&A box. We will have time for questions at the end of our guest speakers. And of course, we want you to join APHEDA. If you're not already a member and donating monthly to Union Aid Abroad APHEDA, we invite you to join today because under the pandemic, more than ever, our solidarity and our financial support with friends and colleagues and comrades internationally is so important. So now I'm going to hand over to Angelo Gavrielatis, the chair of APHEDA, for a few words today. Thanks, Angelo. Over to you. And I think Jared's just going to enable your video, Angelo.
Sorry, just 2 seconds. Yeah, Angelo. You'd be able to talk now.
Is that not working? I don't think, Jared.
You should be able to talk.
The host has stopped my video, it says, but
okay.
Look, I'll start anyway, and if Jared can perform technical miracles, that'll be good. Kate, thank you very much for that introduction. Can I too acknowledge the traditional custodians of the very many different lands upon which this virtual meeting is taking place, and pay my respect to elders past and present. Unfortunately, colleagues, I can't stay on this very important meeting because other matters await, but I did want to join at the beginning in order to express on behalf of the Committee of Management our solidarity with our partners and their representatives, Olfat, of course, Hesham, of course. Can I also acknowledge Kate McHugh, who's joined us as well. APHEDA's relationship with the peoples of Palestine and their ongoing struggles for liberation remains a high priority for us. And in these very difficult times and all times, we extend our solidarity. Our thoughts are always with you, and we wish you well as you continue to struggle through these more difficult times of the COVID pandemic, knowing that it's impacting you as it is all people around the world. I wish you well, my friends, my comrades. Unfortunately, I can't stay with you, but I did want to transmit this message directly to our colleagues and to everyone on this Zoom meeting to know that our priorities remain the same with respect to our commitment to our Palestinian brothers and sisters. Thank you. Thank you, Kate.
Great. Thank you, Angelo. Just for those that just joined, that was Angelo Gavrielatis, who's the chair of Union Aid Abroad, conveying the wishes and support, ongoing support from the Union Aid Abroad Committee of Management. So we're about to hear from our two special guests shortly, but first of all, just want to convey to you some information about the situation for our friends in the West Bank, Gaza, and in the Palestinian camps in Lebanon. As of the 21st of October 2020, globally there were over 41 million cases of COVID-19 and over 1 million deaths. That's 1,130,496 deaths. Of the 41 million cases, 9.3 million are active cases, and of them, 73,672 people are in a critical condition. And that's from the documented cases, of course. As of today, in the occupied Palestinian territories, there are 48,628 cases and 427 people have died as a result of COVID-19. That's amongst a population of 5 million in the West Bank and Gaza. There are 500 new cases daily at the moment. And of course, the pandemic has impacted countries and populations differently, and you'll hear both from Olfat in the camps in Lebanon, as well as Hesham in the West Bank. In Lebanon, the pandemic has especially been a disaster in recent months. Well, it was a disaster prior to the recent months, but as you all know, the country was already battling with a major financial crisis prior to the onset of the pandemic. And the August blast in Beirut, at the Beirut port, further exacerbated the situation. The consequences of this to the already vulnerable population of the Palestinian and Syrian refugees in Lebanon has been dire. They receive very limited support from the international community, and the local government is on the verge of collapse as it tries to deal with the shortage of basic necessities such as food, water and medicine. The deep cuts in international aid to Palestine and the almost complete end of US aid to Palestine since 2018 has resulted in misery for the Palestinian people. And further, in our federal budget last week, our own government announced halving of the Australian aid funding to UNRWA, the UN Relief and Works Agency, the UN body specifically for Palestinians. And the Australian government has cut that support from $20 million to $10 million. This week, Israel expelled the UNHCR office from the West Bank, or many of its staff. The Gaza blockade continues with restricted access, of course, in and out of Gaza, and exemptions only approved by Israel. Israeli settlements in the West Bank continue to be built. So our international speakers today have been fighting for the rights and development of Palestinians in the occupied Palestinian territories and in Lebanon for decades. So our first speaker today, I'd like to introduce someone that many of you have met personally in Australia on her visits here, Dr. Olfat Mahmoud. She's the General Director and founder of the Palestine Women's Humanitarian Organisation, PWHO. She's a nurse by background and has been providing support to Palestinian and Syrian refugees in Lebanon for many years, for decades now. PWHO is the very first partner organisation of APHEDA, and in fact, it's the friendship between our founder, Helen McHugh, and Olfat, which led to the formation of APHEDA. Olfat and her team have been working tirelessly to support refugees in the camps for all these many years, and of course, under COVID, the situation has exacerbated. Before we hear directly from Olfat and her presentation, we're going to see a 2-minute video that explains a bit more about that link between Helen and Olfat. So thanks, Jared.
It was freezing cold outside, and I was dressed in all the warm clothes that I could possibly find. I was lying on the floor of a bombed-out hospital in Beirut in Lebanon. I'd left the United Nations following the massacre of 2,000 women and children in that camp. I was a 33-year-old nurse, and I continued to stay in the camp and work there with the Palestinian nurses. And I was dealing with many shattered people as well as nurses. There was a lot of emergency assistance which flows into a situation like that, but it was very obvious that the shattered health workers needed help to re-establish their working lives. At the time, I was working with Norwegian solidarity workers, and I was really impressed by the way that they were working with the Palestinians in a really lovely sense of solidarity with them. And I thought, well, Australian workers should be doing some of that. I was inspired by those workers, just the notion of their solidarity. I came back to Australia, did some talking around, and eventually met with Cliff Dolan, the president of the ACTU. He liked the idea and he took it to the ACTU executive, and they approved it towards the end of 1983. In January 1984, we had our first board meeting. Soon after, with the help of Australian trade unions and nurses, we were able to start our first training program with Palestinian nurses. APHEDA's work skills training programs were up and running.
Thanks, Jared. So you can see there the very close links between the beginning of APHEDA that continue today, and I'm pleased, really thrilled that Helen has joined us today, and her commitments and commitment to Olfat, the PWHO, and the issues facing Palestinians has never wavered since. So over to you, Olfat. Thank you for joining us today. It's always wonderful to hear from you, and I'll pass over to you. And I think Jared is also going to share your presentation.
Okay, thank you very much. First of all, I would like to thank you all for joining this webinar. I would like to thank APHEDA members one by one. I hope I can name all of them. I would like to thank all the board members of APHEDA. I would like to thank the co-founder, Sister Dr. Hesham McHugh. I would like to thank Philip, Peter, Kate, and I would like to thank Sharon, Jared, Ken, and everybody for this very fruitful partnership. And at all, I would like to thank all Australian people for all their support. Today, I will talk about Palestinian camps during the pandemic. But actually, we have big problem because we have multiple crises. And I will talk about these crises starting from the camp environment. You know, people living in camps for now 72 years before I was born. The camp environment is very challenging. Actually, to be a refugee is challenging. To live in a camp is another challenging situation. The camps are overcrowded, unhealthy living conditions. More than, for example, Burj al-Barajni camp, where I come from, it's 45,000 people living in less than 1 square kilometer of land with very poor services, like starting from infrastructure, drinking water. We have no drinking water. Until now, we buy the city water. Of course, people can't afford to buy bottled water, so they buy the city water from outside the camp. Electricity, it's legal, illegal. It's not legalized by the government, so it's very dangerous, and many people die from electrical shock. Most of the time, we don't have electricity. Education, you know, for refugees, it's still very old-fashioned way, and the healthcare, it's very limited, and it's really a big challenge. In addition to that, we live in Lebanon, so we have to face the Lebanese crisis as well. The political situation, sectarianism, everything, you know, and this leads to lots of trouble and problem. Corruption, and I'm sure you are hearing a lot of Lebanese news nowadays on the TV. Ineffective governance. And this leads, of course, to lots of trouble and the clashes. Economic crisis, inflation, life cost in Lebanon, it's out of range. It's like no one, it's very, very difficult, especially nowadays from the beginning of this year. they can't.
It looks like we might have lost Olfat. Jared, are you sharing the presentation or was Olfat sharing it?
I was sharing the presentation, but she's dropped off multiple times when we were preparing, so.
Right, okay, all right. I think she might have come back. We may have to go to Hesham's presentation and see if we can get Olfat in return. And if we can't, then we might move through her presentation, which is quite informative anyway, if we can't reach her via phone or video. So I'm just waiting to see a few more seconds to see if Olfat can return, but if not, maybe she can join with sound only and not video. Look, I might hand over to you, Hesham. So I'm going to introduce Hesham now, and then we will come back to Olfat.
Olfat's just returned.
Okay.
Sorry.
Olfat, perhaps maybe you might want to take off your video, and that might stabilise things.
Yes.
Jared, are you there? Can you return back to the?
Yeah, I'm just sharing it now.
Okay, and share the. That's great. Thank you. Okay. All right, if you can put that on full screen for us, Jared, that'd be great. And Olfat, you can continue speaking to the presentation.
I think she might be having problems again, unfortunately.
Okay. All right. I'm going to head on over to Hesham and we'll come back to Olfat. So Dr. Hesham Sawaftah is the Project Director for Union Aid Abroad in the occupied Palestinian territories. He's been overseeing our project, which is funded by the Australian Aid Program, called AMENCA III, the Australian Middle East NGO Cooperation project. So, and it's certainly one of our largest programs. And he's also coordinated APHEDA's response to COVID-19 in the Palestinian territories. So welcome, Hesham. It's great to have you here today, and over to you. Thanks.
Sorry.
That's it. That's Olfat. We're going to Hesham first, and then we'll come back to you.
Okay. Okay.
Hesham, again, if your video is not stable, you might want to turn off the video if that's easier for you. Thanks. And Jared, perhaps you can share his screen, PowerPoint.
He's still just on mute at the moment. That's why we can't.
Okay. Are we ready to start? Go ahead.
Hesham, you're still on mute.
Can you hear me now? Can you hear me now?
Yes, we can. Go ahead.
Okay. First of all, good morning, good afternoon for everybody. I appreciate very much this opportunity to talk about the work that we do as a APHEDA team along with our local partners. We have very, very strong partnership here with Palestinian civil society since the late 80s. And I am here to talk about part of the work that APHEDA has been doing in Palestine since then. The work that I'm going to present to you today is actually an effort made by all of APHEDA staff, partner staff, which I would like to mention them by name. MAN, which is an agricultural development center in Palestine. ICP, which is the community development program, part of the Bethlehem University. And also we have the Women Business Association, ASALA. But before we talk about the COVID, I would like to give you some background about the presentation that I'm going to talk. Sorry, can you stay on the previous slides, Jared? So I'll give you some political background briefly, and then I'll move to status of COVID, measurements and impact, and then I will talk about APHEDA-RESPONSE. So in the next slide, you can see here are two maps. One, the one on the left, just to show you actually the West Bank, where the West Bank and Gaza. And as you can see from the map on the left, that if you have to travel between West Bank and Gaza, you have to go through Israel. And the only exit for external travel from the West Bank is for West Bankers has to go through Jordan, and for the Gazan has to go through Egypt. In the West Bank also, if you want to travel between the main cities, you have to go through Israeli control road. So it's not really a free access, if you like. So you can see sometimes if you travel, if you come here, you travel, you can see checkpoints on these main roads. But moving on, I just would like to talk about briefly about the impact of mainly on the income of the BA. The BA budget actually consists mainly of three things: the tax that collected by the Palestinians themselves, and the tax that collected by the Israeli government on their behalf, and then they transfer it on monthly basis to the Palestinian Authority. And the third part is coming from the international communities. If you need more details about the economic situation of the Palestinian Authority, please go and check the World Bank document. There was a release, a brief release about the status of the economic situation in Palestine here. So all of these, tell you that the BA budget is actually or mostly built money coming from outside. In other words, the money source for the BA is beyond their control. So they have to plan on what they get. On April 2020, as a result of the announcement of the deal century, the Palestinian Authority decided to stop all coordination between the Israeli government and the BA. And this resulted in halting all the money transferred from the Israel to the Palestinian Authority. And most of this money, if not all, are used to pay the salaries for their employee. While most of the suppliers and the contractors for the BA are paid through mainly funded projects from the international communities. So if you can go to the next slide, please. Talking about COVID, the first cases of COVID were reported in March 5th in Bethlehem. As you know, Bethlehem is famous for tourism. Everybody knows Bethlehem. And sadly, the cases were imported, of course. The BA immediately responded to contain this virus. So the first step, they did the closed Beit Lahem area. In a way, they separated Beit Lahem from the rest of the West Bank. No people will allow in or out. Then on a few days later, 2 cases or 3 cases have been reported in nearby cities near Ramallah and Jerusalem. So the PA has to introduce new measures to contain and prevent the spreading of the virus. The next slide, you will see some of these measurements. The first one was to restrict movement between districts, main cities in the West Bank. Also, the restricted movement between rural communities and main city. And in order to do so, because of the for different reasons, they have to rely in some cases on volunteers to impose these restrictions. As the picture on the left of the screen, you can see there are volunteers having a checkpoint in order to prevent people coming in and out from one of the Palestinian rural area. And this is, I mean, all of this, I mean, the movement of security and health personnel all over the West Bank need to be coordinated with the Israeli government. I'm not going to go through A and B and C area because I'm saying that most of you know this. And the second step they took is they closed all businesses, being curfew. They only allow pharmacies and bakeries, but also they allow farmers to access their field because vegetables, fruits cannot wait. They have to harvest it. But the problem that you harvest your vegetables, your fruits, but where to sell. So on the next slide, I would like to start with the positive impact of the policy adopted by the PA. The first thing that they managed to control somehow the spread of the virus. We start to see dropping in the number of cases. And quite frankly, during that month, the number of cases reported in daily basis was only single digit, never hardly any cases double digit. They also improved their tracking and testing. You know, this is new. Nobody was prepared for it. So it's like they took the advantage of this month to improve what is needed, basically tracking and testing. And also they start increasing awareness of local people, sending messages, telling people something that's available for everybody to see and know what's this virus about, which actually help people to accept in some way the measurements that the Palestinian Authority has taken. So there was a high level of satisfaction of the policy adopted by the PA. And also, they built or designated some facilities, especially to cope with future COVID cases, patients who might need more health support. And you can see this is on the screen that this is one of the new facilities that established especially for COVID patient, and we have around 34 people are in hospitals now for affected by COVID. On the next slide, I have some of the negative aspects. Before I list them, I just would like to talk to you about the cash flow here. It's very important to understand the cash flow here in the Palestinian market. The buyers actually are coming from those who work with the civil servants, the public employees, and the daily workers, including those working in Israel. So as a result of the current financial situation of the PA couldn't pay the full monthly salary for their staff. They're only getting 50% of their monthly salary. That means that 50% of their purchasing power has been dropped. Likewise, for those who are working on the tourism sector, transportation sector, and other sectors who rely on daily wages, they lost their income, and accordingly, their purchasing power also dropped. As a result, these people have to adapt new coping strategies. Because of these people spend most of their money on food, the first thing that they think of is to cut or strategize their food consumption. So they either cut on food items. Fruit is not a privilege. I can live without fruit, so I don't have to buy it. If I have to choose between low quality tomato and high quality tomato, I'll go for low quality tomato because I can save some money. Also, the debt increased on both small businesses, farmers, breeders, processors, because keep in mind that most of these people have loans from bank and other financial institutions and they have to pay. So it just tell you how difficult it is to sell a product here now. Struggle for small businesses to keep workers. The Palestinian Authority issued like a decree that you cannot ask your workers to leave within 2 months. You have to pay them their salary, and then you have to pay at least 50% of their salary. That put a lot of pressure on small businesses as well to keep paying for these people. So on the next slide, we have the most impacted groups, as I mentioned, that mainly those who work in Israel. The Palestinian workers in Israel, they have to cross between West Bank and Israel on a daily basis. So please also keep in mind that we are also affected with the COVID in Israel, as well as in Jordan. So we are not living alone here. So, and we rely heavily on Israel and Jordan for our economy. The tourism sector since March. I mean, if you go to Bethlehem is not really, it's not, when we talk about tourism, we are not talking about hotels and restaurants, but we talk about every single economic activity in Bethlehem. It's entirely dependent on tourists. So it's one of the really the most affected community here in the West Bank. Also, women-headed households, especially those who rely on support and aid from either international communities or the the Palestinian Ministry of Social Affairs. Farmers and breeders, small businesses. So all of these people are affected. But of course, on the next slide.
Hesham, I'm just interrupting you to just ask you to move, if you can, move through your slides a bit faster. Thank you.
Okay, I'll do that. Sorry. So anyway, just our response actually need to be based on what we're doing under AMENCA III, and we decided to do something that's different from the others by supporting our small-scale farmers and local business partners, as well as people, the vulnerable household who needs their vegetables. So we contacted the APHEDA and we proposed to them to buy vegetables from farmers through our local partners who will pack and deliver these vegetables to the needy people. So on the next slide, we have targeted households in 3 main districts. Bethlehem, as I said, is tourism. Because of tourism, Tubas and Jenin, because they are farming, most of the people living there depends on farm as agriculture as the main source of income. So in the next slide, so we bought vegetables from farmers for 8 weeks, and we distribute them to around 1,150 households. So the people actually put their vegetables, weekly vegetables, and some of them actually get more than 8 weeks. So the total beneficiaries in total, we have 6,000 people received support from APHEDA under this response. On the next slide, as a result of our, this is the major impact, we help farmers to sell their vegetables at good price, which enable them to recover their production cost, improve packing and safety and handling of vegetables, pay wages for daily workers, create jobs, continue farming their lands. The next slide, we have for the small business, our partner, he increased his profit, promote a new brand for safer products, promote trust with clients and especially with farmers and producers, improve reputation, accountability and transparency in work with the clients, expand existing network, including farmers and buyers, and improve capacity and respond to similar matters. We have a system, a new system in place. Here I just skip because I think Kate covered that. We have the number of cases. So since July, we have entered the second phase, which is very severe, and the number is still going up. So I think that's now we are waiting for like master plan for to come from the ministry, the Palestinian Authority, what to do in the coming month to continue support our support for the most affected people. So I think that's all. I know I'm running out of time, so that I have to rush it, but I think in a way, APHEDA impact was very well received by the communities, including beneficiary local committees, local government and ministries. We have a new system in place to support farmers to sell their fresh vegetables. We have wide coverage, as well as we improve the capacity of our local partners to produce, to sell their products. Thank you very much for listening, and again, I appreciate all the time that you spend with us.
Thank you. Thanks, Hesham. A really good comprehensive overview of the state of things there in West Bank and Gaza, as well as the work in recent months under our program work there. So thank you, Hesham, and my apologies, I had to move you along a little bit there. We lost a bit of time earlier. So now I'll go back to Olfat. Olfat, if you're still there, and Jared can share your screen again. And Olfat, I'm going to suggest that if we have trouble again with internet connection, then maybe I might continue to, and you can't, if you can't reconnect, I'll continue to move through your slides.
Okay.
I think they're really informative, and it would be good if everybody could see those before the end of the presentation. So over to you.
Okay. Sorry for that. Very weak Wi-Fi as usual in Lebanon. I talked about Palestinian during the pandemic and also during the Lebanese crisis, political, economic, last Beirut blast, and the virus corona. I talked about lack to work, and because we have no right to work, we are refugees in Lebanon, and how this, and when we had lockdown, how this affect people. People could not work, and especially those who do daily labor, they could not get any income. People rely on relatives abroad to send money. If you ask me about the main income in the camp, it's from relatives abroad. A few refugees have bank accounts. They don't believe in bank, and they don't have enough money to have bank accounts, actually. What is the system? The system is family members, they send money with people through the airport. So now it's impossible also to open a bank account. Airports were closed during the lockdown, so no money brought by passengers, and that left people without any support. Those with bank accounts have limited access to their savings. You know, now in Lebanon, they don't give people their money, and it's a big problem. So even if they have some little money in the bank, they can't access it. Money transfer is very limited. Why? Because it's very expensive, lots of taxes, and application of the official exchange rate. In the bank, the exchange rate is very low, while outside it's much like even more than, in the bank it's $1, 1,500. Outside it's $1, 8,000. So this makes it very difficult. And what about the impact of lockdown on education? Of course, school closed even until now, and teaching is online. That create inequalities because not all kids have access to computers, I mean refugee kids, to computers, smartphones, and internet. Wi-Fi in Lebanon, very weak and unreliable. Limited electricity, like we don't have electricity all the time. Not all parents are educated to help their children or to follow their children education. Children missing out on important development experiences. They don't make friends, they are isolated at home. Increased risk of dropping out, and this is a huge problem now. And as you all know, loss of education has a lifelong impact, and we don't want our children to miss out education. The impact of lockdown on psychological state. People feel unsafe and insecure enough. Lebanon is in economic crisis and political unrest. People have limited ability to help themselves. Why? Not they are lazy. They don't have the resources. They don't have the options. Because they have no income, they can't help themselves. Medical care is very limited and nearly absent. Because camp conditions prevent people from taking sensible precautions, washing clothes at high temperature. We don't have electricity most of the time. Washing hands, our water is very salty and polluted. We don't have drinking water, and the water we have is very polluted. Physical distancing, how we can make physical distancing if people live in very small kind of houses, like it's the size, believe me, it's the size of a lounge room in normal condition. And this makes it very difficult to make physical distancing. So people are
Olfat, I'm sorry, Olfat. Jared, are you moving through the slides with Olfat? We seem to have lost, I think we're a bit behind. I just want to make sure that people can see the slides.
Yes.
And they're on full screen.
Yeah.
Okay. Sorry, Kate, it's on full screen on my computer, so I'm unsure why it's not for everyone else. Apologies.
Are you managing the slides there, Jared? Or is it
No, I am, sorry. But I was being interrupted by people reminding me about the full screen.
sorry. Maybe you catch up to the right slide then, perhaps.
The psychological one, yeah.
Thank you.
Oh, no, this is too far, yes.
Yeah.
So people are so scared from Corona. And of course, because of all these conditions they live in. Vulnerability to Corona, actually in the camp, general level of health and well-being is very low. Chronic conditions spread a lot, like we have many problems related to trauma and distress, like diabetes, respiratory problems, cancer, heart disease, high blood pressure, chronic anemia, and all these people are very, critical to get Corona. On the top of all of that, poor nutrition. People, they don't have enough to eat healthy food. And this is a problem before even Corona. So compromised immune system. And we all know that if you have good immune system, you can resist. If you don't have, you don't resist. And this is, again, a big problem in the camp. So with all these conditions, political, economical, Beirut blast with the Corona, COVID-19. So what was our response as Women's Humanitarian Organization? In normal days, we provide educational, social, psychological support. And during crisis, we provide relief support. In response to Corona, the first thing we did, raising awareness sessions about the dangers of Corona. What we did, in addition to that, at the entrances of the camps, we welcome the people with safety messages, hand sanitizers, and masks. We had telephone helpline, so people can call us if they need any support or help or advice. for psychological and practical support. Sterilize the camp. Spray the camp with sterilizing material to reduce the risk of having corona. And, introduce safety measures to restrict the spread of COVID-19 to continue provision of services safely. Sorry, I am running because I know the limitation of time.
Okay.
We nowadays are facing another problem, decline international support for Palestinians. And as you know, cuts in budget to UNRWA from international community, and UNRWA is the main service provider to the Palestinians. Since I'm talking with Australian, let me tell you, Australia cut its budget by $10 million for 2020-21, reducing healthcare, education, and emergency assistance for 5.6 million of Palestinian refugees across the Middle East, unfortunately, and many countries have the same thing. Palestinian refugees in Lebanon do not seem to be prioritized by international donors and NGOs, unfortunately, because it looks like fashion. Who is in fashion now? And it seems we don't attract much attention from outside as refugees, especially in Lebanon. This comes to, we need your support. And WHO and the Palestinians in Lebanon are so grateful for the long-term support from APHEDA. Still, we are in need because our situation has not changed. It's the opposite. It's a change to be worse. We appeal to your compassion and humanity. Please continue to support us through APHEDA, who provides vital support to Palestinian refugees in Lebanon. And without your support, we will not be able to do that. Your support changes lives for the better. Very little can make a lot. Remember this. And now I will show you some pictures, just few pictures. If you look here on the left side down, this is the camp. And you can see it's overcrowded with people. It's like no space even we have small alleyways. You can't drive inside the camp because we don't have really streets and we don't have spaces. So this makes it very difficult for physical distancing. Inside the camp, I told you, we don't have electricity. The government refused to legalize it. So we have these lines coming from outside to the camp. We pay some money to these electricity lines, but it's not legalized. And the big ones, it's water pipes together. And many people die from electrical shock. The first thing when you enter the camp, this will attract your attention. Hundreds of electricity line above your head. This is what we do, raising awareness sessions. It's sort of like in our offices and the premises. This is how we do physical distancing, small groups with some sort of distancing. This is the precautions at the camp entrance, like they take the temperature of people, they give them safety messages and advices. And here, deep cleaning in the camp, like you see, people spray the camp with disinfectant. And here on the right side, we do our kindergarten that is supported by APHEDA. We always keep cleaning it, deep cleaning. And even we made our own masks with Palestinian kufiya and things like that. And this is distribution of relief, like when we have crisis, as I said, we do distribute food parcel, hygiene kit to reduce the problem. Again, thank you very much for giving this opportunity to me to speak. Thank you, APHEDA. Thank you, all members of APHEDA. And thank you for joining this webinar. Thank you.
Thanks, Olfat. A really good comprehensive overview of the situation, and for people who've seen those photos before, and I know that some of you online have actually visited Olfat and the camps. Certainly those aerial pictures that show you how cramped the area is, and certainly those electrical wires in very, very narrow passageways, it's a pretty overwhelming situation. and made worse under COVID, as you've explained. We've got time for a few questions. So if there are any questions there, please put them in the chat or in the Q&A box. I can't see actually any there at the moment. So perhaps I'll kick off with one to Olfat about if you could explain a bit more about the role that UNRWA has, particularly since the explosion. I know you've explained this to me and others previously, but perhaps a bit more about how you're excluded from a lot of the aid relief and how you're reliant on UNRWA. And I'd like you to explain this because APHEDA is going to launch shortly a petition calling on the Australian government to reinstate that cut to our support to UNRWA, our government and our country's support. And you could explain how vital that is. Thank you.
You know, UNRWA is very dependent on donations and contributions from all over the world. If there is a huge cut in their budget, of course, this affected their services. So even during Corona, from March till nowadays, only they gave people once some financial support, which was not much, but still it's something. And that's only what they did because they don't have enough budget. They gave each member 120,000, which is now 120,000. It's about $20, yani, even less. So this is what they could do. Of course, their clinics is still open. They provide some sort of health clinic services. If people get Corona, and I should say that from the beginning of Corona, we did not have cases in the camp, and we were so delighted and happy. But last month, we started to have cases. And now we, for example, in Burj Al Barazni, 45 cases of Corona. This is the well-known because sometimes people hide. And UNRWA, they do only the test freely because it's very expensive, 150,000 lira to do the PCR, the test. UNRWA, they only provide if you have Corona and your family members and the friends who you mixed with the last few days, maybe they give them free test, but not for, if you have suspect or you have to do it yourself. We have the vocational center up in the mountains. It's a huge one, big one. So UNRWA decided, because now there is no, it's not open, everything online. So they opened this for isolation. Like if people get Corona, they can go there and isolated, because there is no way to be isolated from home. As I said earlier, homes are very small. The whole family, maybe 6-7 members. They share maximum 2 rooms, 1 kitchen and 1 small toilet. So UNRWA provide this service, and we all know, and UNRWA declared that they have big problem with their fund. So this is why their services are very limited nowadays.
Okay, all right. Thank you so much, Olfat. I've just checking if we've got one final question, and perhaps we'll have this one from Tim Diamond in WA before we wrap up. Are you anticipating that the peace deal between Israel and the Gulf states will lead to further shortages of funds to refugee organisations?
Unfortunately, yes. Unfortunately, yes. And it's like, for us as refugees outside the Palestinian territories, the Gulf, they don't even allow us to visit there. And we don't have any opportunity to work there, unfortunately. Earlier, many Palestinians went to Gulf to work, to support their families. For more than 10 years, they stopped that, and many Palestinians even were sent out to Lebanon. So the impact will be really very bad on the refugees.
Okay, thank you. Look, we are going to finish right on time because it's 5 o'clock now. I'm going to finish up with a bit more information for you. First of all, both those presentations which you which you saw today, are available. And so particularly for those of you that are union officials and you've got a chance to present that information in a discussion in your union or others in your workplace, please get in contact with us and we can assist. Both of those presentations are really current, up to date, and are really informative. So if you can make use of them, please contact our office. Of course, if you're not a member of APHEDA, then we're asking you today to join. Please join and donate monthly. Since the coronavirus, and I think you're all really aware of the impact, the health and economic impacts that are only beginning to be known internationally, particularly in poorer countries in our region and beyond, including in our work in Palestine. We need to ratchet up our solidarity, and that means also our financial support. And for those of us that can, for those of us who are employed and can donate, we ask you to join today. I know that there are already many APHEDA members and activists on this line, and looking through the registration list, lots of familiar names and people that are very active in APHEDA. So we're asking you to ask 3 friends to join. And as I said, in the current environment, it's harder for us all to talk person to person and face to face with people. And so we're relying on people to ask others within their network in the online meetings that they're on to join. And I think there's a link to join in the chat. Please use that. It's on our website. And lastly, yes, in the next couple of days, we will email everyone that participated in this webinar with a petition. We're calling on the Australian government to reinstate UNRWA funding and do it urgently because it's there's a desperate need, particularly in the context of COVID-19. It seems that it is a very cruel decision of our government, and we want them to reinstate funding. So when you receive that, please sign it, please share it with everybody on social media and through your other networks. So I'd like to just finish off by thanking our guest speakers today, Olfat and Hesham. Thank you for providing us with a really up-to-date, informative presentation. And more than that, thank you, and know that all of us in Australia and on this call and well beyond stay with you in solidarity through all of these times and through the pandemic. So thanks again to everybody who participated today. It's great to have such a good turn up, and we wish you well for the rest of the day and evening, wherever you are in the world.